Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brian Hamilton.
Welcome to the Healthcare Security Cast. Today, I'm joined by Clete Bordeaux as we discuss visitor management and just talk about some of the differences between Canada and the US. And before we get into today's show, I just want to thank and acknowledge our sponsors and collaborators, starting with 3D Network Technology. 3D Network Technology, reliability is our core value. Visit www.3dnetworktechnology.com. And Genetech, delivering security strategies for healthcare. Visit genetec.com. And Axis Communications. Visit axis.com to learn more. That's axis.com. Also want to thank the Change Execution Group and 360 Life Transformations, as well as Canadian Security and Omnigo Software. And now, let's get into today's show. Welcome to the Healthcare Security Cast. On today's episode, we're joined by Clete Bordeaux. Clete, thanks for joining us today.
Thank you very much, Brian.
Now, I'm going to start off how I start off every show by asking, who is Clete Bordeaux?
Thanks, Brian. Clete Bordeaux currently is Director of Healthcare Business Development for HID Safe. Clete Bordeaux as a whole, in case you care, is 20 years in physical security. And most recently, the last 3 years, focusing exclusively on healthcare. But even before that, started out in the Marines.
Very nice. So what led to you doing what you do now?
So again, always physical security. I had a background in video. So I was actually up there with a Canadian company, but Variant and some of the things that they were doing with the encoders over there in Laval with the smart video and the encoders and stuff. But yeah, background in video that led to intelligent video. And then that sort of took me into the project management space. So then I tried my hand over on the security partner / integrator side, actually bringing all of these services together, and then went back over to the manufacturing side, this time to kind of focus on physical identity and access management. That took me to HID. Once I got there, a couple of projects I got involved with was bringing visitor management into hospitals. This is like 2018, and I loved it. I loved it right away. I got the premise of it right away. It seemed immediately impactful, and I bugged enough people until they let me hop over and do it. But I just had a passion for it immediately. Like all the stuff that HID does is cool from a technology perspective. Stuff on your phone and popping the doors with Bluetooth and NFC and all that stuff. But again, what was immediately impactful for me was just visiting my own mom in a hospital, and how putting two and two together, even before this focus, and saying, wait a minute, no one asked me anything about getting to my mom's room. And at the time, this was like 10 o'clock at night. I was coming back from a business meeting. My sister told me what room she was in, via text. And so with that information, 10 o'clock at night, I parked my car and I went through 2 buildings straight to my mom's room. So again, it helped to cement for me the need for something in place. You shouldn't be able to do that.
No, absolutely. Now, again, starting in 2018, visitor management at that time being something that was new for you, I guess, what would you say were some of the biggest learnings that you had from 2018 till the start of the pandemic? And then I'm going to follow up by saying, post start of COVID until now.
Yeah. So first coming into it was realizing as an industry, people don't do this. Mm-hmm. I assumed maybe it was just my limited experience in I'm local to the Chicago area. In local hospital, maybe that was experience, but it was eye-opening to see. And then, of course, it made sense. That's not the healthcare environment. For decades, it was revamped to be open and inviting, because of studies on patient care, patient experience, et cetera. So, it was redesigned to be open and inviting, and I'm sure it was the same in Canada. So that was the biggest surprise, really, was to see you really re-educating people on the value of this, even with it being such a violent profession, which is super unfortunate. So that was really the biggest eye-opening thing, was realizing, wait a minute, like, people aren't doing this. You're not trying to get them to upgrade a camera, upgrade access control. People get that. They know they need it. They get it. You're trying to like tell people why you shouldn't just allow any random 10,000 people to walk through your facility a week. You're trying to, from scratch, to educate that process.
And one of the things too that I've heard so many security leaders say is, with the pandemic, it's been a lot easier to lock down things. And what I can say is a lot of them have wanted to do this for a long time, actually
Yes.
control access, especially after hours, and know who's coming in and out of the facility. So
Yes.
what have you found have been the biggest changes since the start of the pandemic?
Well, keying in on that particular point to begin with, I think it was IHS actually. IHSS they have a great, based on surveys and stuff, they have a great third-party report they put out. I think they put it out in like 2019, but it was around visitor management, and they did like a survey of the entrance and exits across all, healthcare that responded to the survey, just to show how porous of an environment hospitals can be. So, it's exactly like you said. Even when people wanted to put things in place, they couldn't, because you could enter a hospital from, literally 100 places. I think that IHSS report said that the average was like 12 different dedicated entrances, but some of those things were in the hundreds.
Yeah.
So, how do you effectively manage that? So that's a big change with COVID. Now, like you said, security directors wished they could lock down. Well, now they've been instructed to reduce the number of entries and exits. So everyone that I talked to made that change. Where they could, everyone that I talked to made that change, and they reduced entrance and exit at least some degree. Also, with your question, you said, what's another big change since COVID? Now, we used to preach from a security perspective. And thinking about your experience, you're trying to find out what happened to a piece of equipment, who took a doctor's laptop, maybe patient violence, et cetera. So from a security perspective, that's where we came. Now we talk about it from an infectious disease control perspective. COVID changed that. Now it's about reducing the likelihood of infection, because you're limiting the number of people upstairs. You're screening the people downstairs. That was totally unheard of 2 years ago. This is all new since April, May 2020. And now everybody must abide. And it's a regulatory thing now also. I'd be interested to hear, like JACO is down here. And of course, that's part of their thing. Would JACO apply in Canada, the Joint Commission? Or is it a different body up there?
Yeah, it's a different body up here, the TJC. Yeah. So what we have that's, I guess, similar as Accreditation Canada. Mm-hmm, so, how it's really what's the best way to explain it? They're an accrediting body, not necessarily, you don't necessarily have to meet their requirements, but really at the end of the day, you do.
Yes. Yeah. It's similar down here, very similar. And you know what? I think that there's more organizational involvement. Like, I'm hearing more about organizations that I didn't hear about before, when it was just about hospital safety. Now, I'm not saying that these organizations weren't involved. It's just that, this stuff is bubbling to the surface as, hey, we need to comply with such and such. So they're telling us, I'm just using New York as an example. Department of Health, of course, always has something to do with New York health facilities, but Department of Health then put on their hospitals, hey, you got to do contact tracing. They weren't doing that before, so now these facilities have to stop people. And if you came in there, they got to have your information, because New York Department of Health said that, so it's just interesting. Now that's a state thing to comply with, and that's going to change from state to state. Then you got federal stuff, like we talked about, JACO, in our case down here, there's other stuff like CMS to comply with, and they all are going to have their little spin on what you need to do. Very interesting one I heard just this morning that I never heard before. And tell me if there's a Department of Homeland Security. Is there an equivalent in Canada? A Department of Homeland Security equivalent?
Oh man, there'd be an equivalent. I couldn't even tell you the name of it, but it wouldn't be as prominent here. Like, I know what the Department of Homeland Security is, yeah, being Canadian, but I don't know what we would even call that in Canada. But yeah, we do have our own security measures in place.
Yeah. So doing this 3 years, I never heard their name tied with healthcare.
Mhm.
Came across the East Coast, prominent East Coast facility this morning, and we were going through our thing with them, discovery, understanding their environment, and they got dinged before COVID. They got dinged by Department of Homeland Security. So I stopped the lady to ask her. I said, "Wait, you mean Department of Health?" She said, "No, DHS dinged us for not having." They made a very strong recommendation that we put a visitor management system in place. And this was from the security perspective. Again, maybe because it's a prominent facility. So this is even before COVID. But
Wow.
again, that's just one more third-party organization that is, pushing their way into healthcare and saying, "Hey, you should probably do something. You should probably do something."
Interesting. Now, in terms of trends that are impacting visitor management and as it relates to healthcare, what are some of the things that you foresee happening in the future?
I foresee optical barriers coming. I foresee more integration with access control. And I just base that off of the weekly conversations that I have. It was a taboo subject a few years ago. I had a very forward-thinking hospital that we were talking to starting in 2017. And it was an unheard of concept. And when I say optical barriers, I use that term because they smacked my hand and told me we can't say turnstiles. But if you think about it, I'm not sure if you've come across them, but think about they have a very open and inviting look, but they're like laser etched Lexan glass or something like that. And it would open up. It's got your name on there, Department of Health, Toronto Hospital, whatever the case may be. And there's a reader on there, and it just opens up and lets you go by, large enough to get by gurneys, wheelchairs, all that stuff. So they were doing it, vanguard with it, and no one else was talking about it. Like, oh, we wouldn't put that in a hospital setting. Talking about it since 2018, implemented it in 2019. Now somebody talks to me about that every week. So I mean, that's an absolute trend. You said, like you said in the beginning, there was what security directors wanted to do before versus what they're able to do now. Now they're looking for means to effectively control the number of people visiting a patient at any one time. That's absolutely a trend. That goes without saying. That's something we were able to do for quite some time, and certain institutions were interested. Now everyone is interested. At a minimum, the conversation starts with, can you control the number of visitors that go see Brian, the patient? At a minimum, you got to start there when it comes to visitor management as a trend. But that optical barrier and doing more with access control, where that was like pie in the sky thinking a while ago, everyone wants to talk about that. And they're expanding the use of it. They're now taking that concept with the paper badge or whatever, they're taking that concept even up to the unit. And they're asking to retrofit and add that to the unit.
Interesting. Now, the other thing I'm curious to learn more about, and how you've seen this kind of deployed in the past, or even today, is just in terms of accessing resources for visitor management systems that would, say, for example, cross-reference a sex offender registry.
So that has always been something that came about because we would frequently talk to pediatric institutions. They care about that kind of stuff. Mm-hmm. So that's something that many visitor management systems have been doing for quite some time. So now, as we're talking to more, because they have to do something, now the conversation is coming up even more. But it's super interesting that when I talked to, I feel like it was an Alberta facility, that's when I became aware that there is no national database that I could hit if it was to be a Canadian institution. That's I don't know if it's an information rights issue or whatever the case may be, but yeah, we could not do that same in Canada. But down here, there's absolutely several. Well, there's a central national database for criminal activity, and it's just a matter of which service do you pick. And so, I'm sure visitor management systems out there have ones that they work with. We have several that we work with, and it's using any one of those to hit our national database.
Awesome. Now, you mentioned one thing earlier that I want to kind of circle back to. You talked about the IHSS third-party report that you used.
Yeah.
Now, one of the things that I appreciate about you is the approach that you take. You're someone who wants to learn. You want to learn about the customers that you're serving, the challenges that they have, their industry, and it feels, I don't know, in case any of your superiors are listening, I don't want to, I don't want to make you sound bad, but it doesn't seem as salesy. You're actually trying to educate yourself about the challenges that we face. And I guess my question would be, again, for anybody who's listening, maybe who's on the vendor side of things, how have you seen that approach really be beneficial for you in terms of just how you do your job every day?
Thank you. I think that's a compliment. Thank you.
Yes,
And
yeah, that's very much a compliment.
and you know what? You really hit the nail on the head. And that's actually why I'm very passionate about what I do, because I really enjoy this very specific space that I'm able to fit into. Because I'm not a salesman. That's exactly what it is. I am not attempting to sell as business development, which is why I fought to get into this little niche position that I came here. I really am just trying to change the industry. I am really trying to keep up with it. I'm trying to respond to its needs. And a heavy, heavy component of my job is education. So, we had an hour and a half call this morning, and there was, they had already done a pilot. They had already had a consultant in there, and I probably still spent 30 to 40 minutes telling them what other institutions have done. Because it's, healthcare is a very collaborative environment, especially since 9/11. And that came from me from several security directors. After 9/11, they all, shared their information. So it's nothing for one security director to call another and say, hey, what are you doing? And, with this being something new that they're all trying out, you could have a security director, that's been in the business 3 decades and never had a visitor management system. So education is a heavy component of it. And again, it's a super easy concept to grasp for me, one I'm very passionate about personally. So I think that's why this fits well. That's why it doesn't feel salesy, because I really am a student and a proponent of bringing about change. There's another thing actually that's also self-serving is my girlfriend is actually in healthcare. So my girlfriend's in healthcare at a local hospital here in Chicago. So the fact that it's such a violent profession really hits home for me. But thank you. Thank you. That is what I pride myself on. I am not concerned with the sale. I'm much more concerned with, providing a solution, helping the industry make a shift. Security director, actually, that hospital I told you about, they won an award. The one that, if I didn't mention that, the one where they had the optical barriers and they've been talking about it for 3-4 years. They actually went on to win an award in 2021, the Boxer Bomb Security Design Award. But that security director, Mike Ramstack, he had some great data that he collected ahead of time that also helped to open my eyes that anything can help. Not my solution, anything can help. What he did was he put in a pilot program, and this is something that I would love for other security directors to do. He put in a pilot program where I think he did it started after hours, but after hours, he began to stop people just to ask for their ID. So they were previously in a fully open environment. Mm-hmm. After hours, he started just to ask people for their ID as a pilot. And once you reduced people walking through the halls anonymously, his incidents dropped in I don't want to quote him, but an incredible amount just by asking people for their ID. His overall incidents, that's everything. His overall incidents dropped. So, you can't argue with that. We are in a time when we need to do something. It doesn't have to be, a solution from Clete, but everyone should be looking to do something.
No, that's really interesting. And I'll probably, now that you put that in my head, I'm probably going to have to actually reach out to Mike to learn more about that that trial and see how. Definitely want to find out more about that.
Mike's a great resource. If you can get back to him, he's a great resource. He's done some very forward things because he came outside of healthcare and he's bringing some of those things into healthcare. And you know what, Brian, that's another point is why education and why understanding what the drivers are, what the pain points. Another reason why that's important is because many times I'm helping and I keep saying security director because typically that's who I interface with, but I'm helping whoever the champion is, guest services director, I have to help them prove their case to senior leadership. So Mike did all that stuff and he was a great example. he didn't come to them just asking for, hey, can you give me $500,000? Because I think a visitor management system would be cool. He had data. He came with data. Here's incident reduction. He had surveys, HCAP scores changed, so he went before them, and he didn't have to make his case. The numbers made his case. So a lot of times I am also helping people to make their case to senior leadership. Tell us some other places this was effective. What can we get out of this? So I guess that's another reason why I'm just a consistent student of the game, trying to understand what people are doing, what worked,
Yeah, no, and that's great. And no wonder he's able to get buy-in. If you can show an impact on the HCAP scores, that's definitely going to go a long way for you as a security leader.
You know what? Now that's a cool point. HCAP, is that a USA thing or is that international?
No, that's US. Okay.
You have something similar?
No, because our business model is completely different. We're being universal healthcare here versus, that more business model in the US. So unless you have a special tie to a hospital, you're going to tend to just go to the closest one. Whereas, it's more business oriented in the US, where you're going to look for things like HCAP scores or, whatever the deciding factor is going to be for you. It's not necessarily going to be just the convenience of the location. But no, it's an interesting point though. But yeah, anywhere where you can show that kind of value as a security leader, especially when you start kind of thinking outside of just that general security box, definitely going to have an impact on your success in getting those dollars and getting the buy-in for those projects for sure.
Yep. You know what? And when you say getting buy-in, that just triggered me to think it doesn't happen often, but typically, how are we going to approach a project, especially if we're talking to senior leadership? How do we approach a project? We're talking about ROI. They're looking to see what's the ROI, what did we save by doing this? And, every now and then I kind of have to start from scratch with some of the organizations, because when you're talking about safety, when you're talking about compliance, a lot of times that's not based on ROI. You know what I mean? Or it's not based on ROI, a tangible ROI that's going to show up on a PowerPoint. It helps with patient experience, it helps with HCAP, et cetera. It gives you compliance with Department of Health, DHS. So it gives you compliance, but that doesn't necessarily give you ROI. So, for anyone listening out there, that's not the approach when you're talking visitor management. It's not about ROI. It's about the other things that happen, so it's not, getting a high-tech camera, for example, one of those 360 cameras, and instead of buying 4 cameras, now we buy 1. ROI is easy. This is not so much that kind of thing. And that's going to apply across the board. So I think that's a good little tidbit for anyone out there. Don't approach it looking for ROI. Approach it looking for compliance with federal, local. Approach it looking for patient experience, infectious disease control. That's a good approach.
Yeah, and I guess too, if you're looking at that patient experience, that does have an indirect impact on ROI to some degree.
Yes.
So.
Yes. It's just hard to put that into a PowerPoint.
Yeah, no, definitely. And it's hard to define that and really spell that out as well. But at least, you can kind of work towards that direction. We start talking about that patient experience. Yeah, they can definitely make a difference.
You know what? I know another guy you would know, and this was another eye-opening piece of data, Brian Warren.
Oh yeah.
So yeah, as a matter of fact, I think he's probably been on your show.
Yeah. Oh yeah, he's been
on. So he was at one of our customer advisory councils in Vegas. I want to say 2019, but eye-opening piece of data is, he put it in such simple terms. That's why I love Brian. He put it in such simple terms. He said, your good nurses, if they don't feel safe, they'll leave. He says, who won't leave? The mediocre nurses. And then he put up there on the board, how much does it cost? Every time you lose a nurse, that costs you $100,000. Between recruitment costs, onboarding, salary, on average, everyone you lose costs you $100,000. And then you also have to remember who didn't leave. The good ones, the marketable ones, the highly valuable ones, they jumped ship, they went across town. You're left with those that felt they couldn't move, et cetera. So, when he put that on there, I'm like, wow. So, and again, this was a different time. This was 2019 when we were all much more concerned, and I'm sure the industry still is, but when the main point was, hey, let's do something about healthcare security. And so that was the main point in helping people on the clinical side feel safe. When they walk in the halls and they see this, random dude, Clete, in a hoodie going to visit his mom at 11 p.m., that's a little unsettling, and I get it. And so, when you think about it from that perspective, they want to feel safe. They're very valued. And I guess that is also where you can make a case for ROI. You want employees in satisfaction, just like you want that patient experience.
Yeah, and it kind of all ties together too, because that employee satisfaction is also going to have an impact on the patient experience. But no, Brian is he's definitely always been way ahead of the game in terms of pulling out numbers and really just being able to demonstrate the value of what we do. I don't think there's really anybody. I'm sure there's somebody out there, but I haven't met them yet who can do it quite like Brian does. And out of anybody, we were talking about education a little bit. If there's anybody that you can learn from, if you see Brian Warren's name on, at a conference that you're going to be attending, you just make sure that you're in that session, because you're going to learn something. You're going to learn something from that man. I could listen to him talk about security, all day.
You are exactly right. I remember specific points you called out. That was another one of the things that was part of his presentation to the group, was the value of education and how, how you can show the organization the value that security is bringing by some of the training that you can offer to other people that's there. So, fully agree with you. He had excellent ways to put real, tangible organizational value around what it is that security directors are going to do.
Yeah, and he can make it, much to your point, he can make it simple.
Yeah.
Just like no one else can as well. So no, definitely a great resource. Thanks for pointing Brian out, because again, I could do I did the one episode with Brian, but I could probably do like a monthly episode with Brian. He's got so much knowledge.
Of course you could. Yeah, you could. You could just pick one topic and let that be the podcast for the rest of the time.
Yeah, that's kind of how I approached it last time.
Yeah.
Like, this is what we'll talk about, and he's got so much knowledge. It's crazy. Awesome. Now, in terms of, I guess, just what you're doing on an everyday basis. So, you came in with the approach of, when you spoke to me originally, let's just make this educational. You weren't trying to sell anything at all, but I do appreciate that. So I do want to give you a chance to sell. So can you just talk about some of the services that you do offer, some of the things that we can expect in the future as well from HID?
Oh, wow. Unexpected. Thank you. And not necessary. But just who I am and what I'm doing it for is, again, business development, internationally, but no one fits the model quite like the US for various reasons, but just trying to grow this business. But specifically what I'm specializing in is bringing physical identity and access management, bringing that into healthcare. What does that mean? That's visitor management, like we're talking about now. Super easy. That's the low-hanging fruit, is visitor management. But then, bringing it in a way where we can talk to multi-state organizations now, because now we're presenting enterprise software to do this. IT is at the table right away. We're talking enterprise software. I present a solution that is able to respond to the various needs. So a single healthcare organization could have it, but then it could still respond to the differentiation necessary for a Wisconsin facility, a Wisconsin hospital versus an Illinois hospital. I'll give you a great simple example. There's a facility up in Wisconsin that has SAFE, HID SAFE, that's our product. How they do their COVID screening is different than that same organization, but at the hospital down in Illinois. So they're able to have that differentiation all from a single system. And then they're able to take it to the next level and integrate access control. So it's bringing tools to healthcare security that weren't there before. So again, that's why we're trying to help convince people about the need for it in any way, shape, or form. And quite frankly, my solution does not lend itself well to everyone. But there's some people out there where they will realize, okay, well, we got to do something. And I'll just think about, the organization I was talking to this morning, world-renowned organization on the East Coast. Okay, we have to do something, but we don't want to piecemeal this. We need something that can, they're multi-state. So multi-state, 1,500 bed facility. We want to have a world-class experience. We have disparate access control systems. So that's where we're going to play. That's an area where I bring value. That's an area where HID SAFE brings value. So there are many access controls out there. HID actually has a couple of them, sorry, many visitor management systems. We have Easy Lobby, but then we have Safe. And we have standardized on Safe just because of that healthcare focus, just because of our ability to respond and Safe's ability to respond to the industry. It changes. COVID's a great example. We changed our software because of COVID, many people had to, but when you think about it, it was no easy task to change software in $1 billion company. So it's a bit like turning around a 787 or something like that. But we made some adjustments for COVID. We made some adjustments to adding in screening questions and these things that didn't exist in software before. Adding in enforcing based on the unit, able to enforce patient visitor limits. So behavioral health might have a limit of 2 visitors, and the rest of the hospital might have a limit of 5. We brought that kind of stuff forward as a response to the industry.
Now, in terms of the technology, because again, people always want to hear about the technology that's out there. You talked earlier about some of the ways that you could use the phone, Bluetooth, near field communication technology. Can you expand on that a little bit more?
Yeah. So can HID do that? Absolutely. So very similar to how you would have a boarding pass on your phone in the wallet. So we can put things in the wallet. If you have done digital check-ins at a hotel and you're close to the door and you can do it, we have the ability to put all that on the phone. But here is the rub in the healthcare environment: cost. If we're going to talk about visitors, that's a lot of visitors. Even when it comes to paper, that's an exponential cost, and paper is a fraction of a cent each. But when you're talking about tens of thousands of visitors, in some cases per month, cost has been prohibitive. But when it comes to cool tech, we have a world-renowned facility up in Minnesota that they're not tracking people, but they're tracking their devices using real-time location. As part of HID, it's part of our software offering. Of course, like I mentioned before, doing disparate access control systems. But when I talk about how they're starting to use optical, that's really just paper. So that's not very high tech at all. It's pretty low tech solution, but it is bringing forward levels of control that the healthcare industry didn't have before. So when I talked about that hospital in Wisconsin, what they're scanning is really a piece of paper with a barcode on it. So that's not high tech at all. But we're able to marry that up with, in their case, they have a Genetech system. We're able to marry that up with their Genetech access control system. So now that barcode means Brian is clear to visit until 8 p.m. And we're able to make that leap there.
Awesome stuff. Now, as we start to wrap up, do you have a special message for the healthcare security cast community?
I have said a lot, but I do think one thing I'll share, and I've heard it several times over. So these are not my words. This is what I heard from, several ways that they've been creative with it, but they'll say COVID was to healthcare what 9/11 was to the aviation industry. And again, they've said it various ways, so I'm paraphrasing, but what they're telling me and what I understand that to mean is healthcare is never going to go back to where it was. So those are the conversations we're having. By the time people bubble up and it makes its way to me, those are the conversations that I encourage the security community to have. Like you opened with, COVID changed literally the environment that we work in. These hospitals have reduced entrances and exits. They have mandates to meet. This is their time, and it's never going to go back to where it was. We loosened up a little bit. When you think about air travel, we loosened up a little bit, but it's never wide open the way air travel was. And so plenty of thought leaders in the industry feel like healthcare and hospitals in general will never be wide open. Anybody can go anywhere they want to again. So you have to start giving thought to your 22 plan, your 23 plan. What do we put in place? How do we manage compliance and all that stuff in this new environment? So that's the advice I would give to the industry. Think about your 22 plan, 23 plan, and do not assume that things are going back. Your colleagues are planning for things never to return the way they were. Do you agree with that?
Oh yeah, no, I agree. And I think that's, and I can't speak for others per se, but it seems to me that that's the way a lot of security leaders want it to go. They do want to see, some of the, not the restrictions that we have to this degree now, but definitely more restrictions as to who is able to go in and out of a facility. And
Yeah.
it makes sense because, again, you're able to eliminate a lot of those bad actors, or it just really making people aware of the fact that they don't have it's not a free-for-all when you come into a healthcare facility. Again, it's only going to have a positive impact.
Like you said, when you said security directors, want to do something like this. One of my buddies, he was the security director at Rush, and he now works for Telgen as a consultant. Loris, he said, if they leave it up to me, I'll get blood samples. He doesn't want to stop at IDs. He said, if you leave it up to me, I'll get blood samples.
Sounds like something he would say. Yeah.
Yeah. Oh, Loris too. Yeah. Yeah.
Awesome stuff. Now, Clete, for those who want to reach out for you after listening to this discussion, what is the best way to connect with you?
I'm on LinkedIn, Clete Bordeaux, Bordeaux. So I am on LinkedIn there. It's probably the best place to start. That way you can follow along as I post different things like this podcast and other educational things that I share, IHSS reports, etc. So that's probably the best place. Clete Bordeaux on LinkedIn.
Well, perfect. Well, Clete, thank you so much for making the time today. I appreciate it. And hopefully everybody had an opportunity to learn quite a bit from this conversation.
I agree. And thank you for having me.
You're very welcome. The Healthcare Security Cast is available on Spotify, Apple Music, Amazon Music, and Audible, and many other platforms as well. Check out our Linktree on your computer or mobile device. And this can be found at linktree/Brian Hamilton. That's linktr.ee/Brian, BRINE, Hamilton. Again, that's linktr.ee/Brian Hamilton. Or if it's easier, send me a text at 647-372-2042. That's 647-372-2042. And I'll be happy to answer any questions you may have or share any links you may be looking for. Thanks again for listening. Until next time, take care and stay safe.